right, so we'd like to start our presentation by asking you guys to write down 5 words that come to mind when you hear the word obesity.
So I'm going to hand them out to you right now and just go write down those 5 words. All right, here you go. 5 words, write down for obesity. Come to mind.
And then we'll collect it.
Yes. Done? Yeah.
Some of my words are like 2 words.
Habits.
All right, so we're going to quickly read through some of these that maybe stand out to us. So unhealthy, lazy, unmotivated, diabetes, uncaring, fat, lazy, unmotivated, diabetes, chubby, poor nutrition, junk eaters, poor self-image, impulsive, fat, overweight, diabetes, unhealthy, eating a lot, unhealthy, heart disease, unhealthy, and lazy. So we have a lot of the similar words. I would say unhealthy, lazy, and unmotivated. Diabetes, they seem to be like the most common that you guys wrote down. So we're gonna discuss with you guys obese and overweight patients and addressing weight bias in healthcare.
The objectives are to understand obesity and its prevalence in the U.S., identify weight bias in healthcare, and identify your own conscious and unconscious bias of overweight, obese patients.
So like what is obesity? So obesity is defined as abnormal and excessive accumulation of fat, which might present a risk to health. So like the different BMIs, we learned in class, like the underweight is like 18.5, and then normal is 18.5 to 24.9. Overweight is 25 to 29.9. Obese is 30 to 34.9, and extremely obese is 35.
When looking at BMI, you have to also take into account muscle, because muscle weighs more than fat, but we'll talk about that later.
So one question we have is BMI always reliable? So right here we have some statistics of 2 football players. These stats came from 2016, where Seattle Seahawks Russell Wilson had a BMI of 30, which categorizes him in obese BMI, and Tony Romo had a BMI of 29.5, which also categorized him in an overweight category. So these are 2 football players in the NFL. They're physically fit, they work out weekly, and obviously I wouldn't say that they are unhealthy. They just seem to have more muscle than fat, so that overcompensates when calculating their BMI.
Assessing obesity in the United States. Obesity is escalating in epidemic proportions in the U.S., which means that each year more and more people are considered to be obese. In 2015-2016, the prevalence of obesity was 39.8% in adults and 18.5% in the youth. Obesity-related conditions include heart disease, stroke, type 2 diabetes, certain types of cancer, and that are some of the leading causes of preventable premature death.
So like diagnosing the problem. So like the overweight population is reluctant to seek medical help, not only for weight reduction, but also because of perceived provider discrimination. So like when they really don't want to like go to the doctor because like being embarrassed to go to the doctor, like some of the words you guys said, I'm fat, I'm unhealthy, and I'm lazy. But it's just like their way of like trying to cope with it and not wanting to go to the doctor just for those reasons. So then providers who are biased against individuals' obesity patients' effort to effectively fight the obesity epidemic. So with like providers, maybe like they don't like taking care of people that are obese. I know that when like in the nursing field, like when you go to clinicals or your job or anything, like you know when you have like that overweight patient and you have to try and move them, you're like, oh, like I have to get more people to come in and try and move them up in bed and stuff like that. So that's like the problem with like nurses, like all PCAs, and doctors as well. They always have like that prejudgment with patients that are obese.
And those obese patients can recognize those feelings, and that could also make them not want to come back to the doctors because they don't want to feel like there's such a burden on everybody.
And then they know they're overweight as well. They don't want to be constantly reminded or be like a nuisance to them. They know it already. So like we as healthcare providers and nurses need to like be aware of our own biases and understand that they are human beings as well, and like that we shouldn't treat them any differently than any other patient.
So we're going to continue with the nursing process. We assess the problem, we diagnose the problem, and now we're going to plan. So first, we need to address weight bias in the healthcare setting. This is identifying our own personal bias, whether they're conscious or unconscious. And then with a goal of making overweight individuals more likely to engage in a meaningful and productive discussion of their weight. So like we discussed, or like our classmates discussed earlier, with therapeutic communication, that's huge when talking to patients that are overweight or obese. It's a very delicate topic for them. Like we stated, they're very insecure about their weight. They already know that they are obese or overweight. And it's our job as nurses to try and have productive discussion with them about their weight and what we can do to help them move forward in their health.
Interventions: assess your personal, implicit, and explicit biases on the obese population. Become aware of your biases and take action to redirect your responses. Use strategies to reduce implicit biases.
So like with the interventions too, because I know like for everyone that takes nursing tests, like that always the answer is like assessing your own bias before you like walk into any situation. It's important to understand like where you stand in this particular situation. So like just understanding like what's your standpoint on it, and just like being aware of it and not acting out on it or anything. Just keep it like personal and just understand it and.
And back to the example we said earlier, you have a call light go off for a patient that is overweight or obese, and you know the thought comes in your head, oh, I don't want to have to move them. That's going to be so much work. It's going to take so much of my time. You need to assess yourself. Say, okay, I just have this implicit bias on my patient. I'm making myself aware, and I'm going to take the actions to redirect my response. I'm not going to not go and answer the call right away because I don't want to do it. I'm going to get coworkers to help me, and that's just how you're going to reduce the implicit bias.
And also, other one, a lot of the time, you have to not treat all obese people the same way, because one might be stinky, but don't just assume that just because that one was stinky, that everyone else would be stinky. So you have to kind of just treat everyone the same,
And I would say on top of that, if you do have an obese patient and they do smell, that's your job as the nurse to clean them. It's our job to keep them and care for their self-care. So that just shows that maybe the previous nurse that was on duty didn't do all of their roles as their nurse.
So assessing your implicit bias. So we looked up like online to look at different tests to identify your own biases. So if you guys want to use your phones or use the QR code and just take the implicit bias test, and just if you like to share your results or not, it's up to you guys.
So we'll just click to show you guys the website. It's going to pull up to Project Implicit, and you're going to click Wish to Proceed. And then you're going to scroll down and click Wait. Oh, it's actually,
You guys do. You guys. No.
So the test asks you to, it's going to show you a selection of pictures and words, and you need to group them as fast as you can. It's a 10-minute quiz, so you're just gonna follow the instructions, and it'll show your results.
We can come back to like you guys can like listen as you do the quiz, so then we'll come back to like your answers after. But so what we like basing off our self-reflection class taught by Professor Dr. Igo. So it's to engage in introspection and self-reflection to build a strong foundation for the development of authentic therapeutic relationships with culturally diverse clients. Also, exploration of personal values and perceptions, and addresses conscious and unconscious bias inherent in cultural differences that serve to separate nurses and their clients. Also focus on selected, diverse, and often vulnerable populations to highlight disparate value systems that may compromise the acquisition of health information and impede therapeutic conversation and achieve next health client-centered outcomes. So just like tying into like what we learned in class, like understanding like what I talked about before, like your biases and like all the cultural differences in like you would get during your experience as a nurse or extern or in clinical.
And we highlighted some of the words in these bullet points just to emphasize the topics that we discuss in class. So we have a lot of self-discussion and self-reflection with introspection, biases, and cultural differences, and specifically vulnerable populations.
And these are some of the references that we use to make this presentation.
As you guys doing the quiz, is it like hard to do it or like it's kind of like a fast-paced kind of thing? You gotta be like,
It's like a fun game.
yeah.
You have to click really quick.
Yeah.
So if let's actually see if I can.
You want us to pull it up?
Yeah, because I think they should do it on their own. Okay, so this is pretty much what it is, and you use it's easier to do, I think, on the computer, but you use your E and I computer keys to categorize items into groups as fast as you can. These are the 4 groups and the items that belong to each. So good category would be magnificent, joyous, pleasing, pleasure, glorious, triumph, terrific, cherished. Bad words include grief, nasty, horrible, selfish, yucky, bothersome, sickening, disaster. And then it shows silhouettes of fat people and thin people. So it says you put your left finger on the E key, and that is going to identify the category for fat people. And you put an I on, or your right finger on the I key to identify thin people. And then put the space bar to start. Part 2 is doing bad words for E and good words for I. So then it combines the 2 categories of identifying bad people and bad words with E, and I with thin people and good words. And then the same thing for part 7. and then it switches it on you. So use E for thin people, I for fat people. So pretty much it's just testing your reactions and your brain and how we think about things. Good.
Also identifying like your implicit biases based off like how you associate what you're doing to like what you see.
Then now it switches, and for E you use thin people with bad words, and then I if it's fat people or good words. I'm going to ask you just some personal questions about you so they can get some demographics.
Right here.
So then it says your responses suggested a moderate automatic preference for thin people over fat people. So you can base your results off of what it says, and it kind of just identifies if you have implicit bias towards fat people, thin people. It's also based on your previous answers to questions that they asked before you do the game. This then, once you complete the study, it discusses some facts and questions about the implicit test. So it has some results. And it shows that 31% have a strong automatic preference for thin people compared to fat people. And only 15% would say little to no automatic preference between the two. So pretty much the game like tries to see if it trips you up with clicking what's right or wrong, and based off those results, it categorizes if you have any bias. And if you do, that just shows that you need to identify that and redirect your actions so that we can provide better care for our patients in this population. And that completes our presentation.
You guys have any questions?